Welcome to Dialogue with Deidre. I'm your host, Deidre Malone. In this edition of Dialogue with Deidre, we're going to be talking about the Affordable Health Care Act. My guest is Vicki Moore. She's a certified application counselor, and she is going to be the guest today in our hope is our first half hour of the show. We're also going to be talking about cyberbullying, specifically Elizabeth Lauten. I'm sure you know that name if you followed any social media or any network news over the weekend. We're going to be talking about the comments she made about Malika and Sasha Obama, and we're going to talk about whether or not she still has her job working for Representative Fincher. We also want to touch on the fact that there was an article as of late that discussed the percentage of African Americans who are in jail, specifically in Tennessee and southern states, and how that affects the African American voting bloc. And then, of course, last but definitely not least, I think Darren Wilson resigned from the Ferguson Police Department. And did he get a severance package? We'll talk about that as well. You're watching Dialogue with Deidre. We'll be back in a moment.
And on behalf of MUTV1, we would like to wish you a happy holiday and many more to come. Stay beautiful.
So they say it's a man's world? I don't see anybody's name on it.
While they were doing their thing, we slowly changed all.
Today, women can do anything men can do. And there's one thing we're even better at.
Wow, tell around your drugstore, and your drugstore. Hey, we everyone's drugstore. And we're located at 3333 East Chevy Drive, 794-3690. All medical plans. We support supported living, assisted living. We do it all. And guess what? We even have a $4 plan. Hey, call to ask Dr. Brown about that. I gotta go because she's coming with those boots.
The Carter Malone Group is a full-service public relations agency. Celebrating 10 years of being in business, the Carter Malone Group is located in Midtown Memphis and represents clients across the country. No matter what size your business, if you are interested in promoting your product or service and increasing your market share, contact the firm that can help you meet your goals. The Carter Malone Group. Call 901-278-0881 today.
And now, let's take some questions from the public.
Mr. Chairman, why do we keep cutting back on education?
Governor, you want to take that question?
Mr. Chairman, let's give this one to the Senate Majority Leader.
Since this matter was taken up in AB 3712, I think it best if I defer to the Assembly Majority Leader.
Actually, pursuant to Department of Education statutes, the State Secretary of Education would be more qualified to answer. Mr. Secretary.
My legal team has advised me not to comment at this time, so I'll humbly refer to our State Superintendent of Schools.
Pass. Definitely pass. Okay, County Superintendent.
Well, young lady, it's just too complicated.
Can you tell me who's responsible for my education?
That is a good question. Governor?
Repeat the question, please.
I don't see why I can't get an answer from
You're asking a lot of difficult questions.
Oh, she sure is.
Who are you?
Well, I'm the governor.
What is this?
Your 2 minutes are up!
Stop the circus. Contact your legislators at thisbudgetblows.com.
Welcome back to Dialogue with Deidre. I'm your host, Deidre Malone. The Affordable Care Act, there is time still for those who need insurance, health insurance, to fill out an application. And we're going to be talking about that as a good part of this show today. Our guest in the studio, we're hoping that she arrives relatively soon. If not, Ms. Vicki Moore, we still have a wealth of information that we're going to share with you because it's important for you to know that small businesses and businesses in general are going to be required to have health care. And if you are in need of it, now's the time to be applying for health care because it should be affordable for you at this time. We're also going to be talking about a number of other things. And first off, I'd like to just share with you, I'm sure if you watched any news over the weekend, you had an opportunity to see a major gaffe that a communications director for Republican U.S. Representative from the state of Tennessee, Stephen Fincher, his communications person made this comment about President and Michelle Obama's daughters, Sasha and Malika. I'm sure you watched on Thanksgiving, right before Thanksgiving, when the President Obama, pardoned macaroni, I think it was mac and cheese, the two turkeys. You watched that, and like most teenagers, because I'm sure that my sons did the same thing, whenever dad or mom and dad say something that they might be a little corny, I mean, they just kind of stood there and looked, as teenagers do. But they were very cute, dressed very appropriately, in my opinion, and a lot of other people's opinion, obviously. Well, Miss Elizabeth Lauten, the communications director for Stephen Fincher, put something on social media. And this is basically, in a nutshell, saying that the first daughter should try showing a little class. And this is what she said. Dear Sasha and Malika, I get you're both in those awful teen years, but you're a part of the first family. Try showing a little class. At least respect the part that you play. Then again, your mother and father don't respect their positions very much, or the nation for that matter. Spoken like a true Republican, because she used to work for the GOP, specifically the Republican National Committee. So rise to the occasion, she said. Act like being in the White House matters to you. Dress, basically, like you deserve the respect, not a spot at the bar. And certainly don't make faces during televised public events. Okay, a spot at the bar. I think these young ladies are like 13 and 16. She's saying that they dressed like they wanted a spot at the bar. A lot of people were outraged, like I was, at the fact that she had the gall to even post this on Facebook. But then I guess she probably got into a little hot water, because then she came back and apologized on Facebook and said that after, some prayer and thought that maybe she was a little bit out of order. So she apologized and came back on Facebook and did that. But we just found out, and we learned through the Huffington Post, that Ms. Lauten has resigned her position as the communications director for Representative Fincher. I really want to know if it was a forced resignation, because if I'm Representative Fincher, you know how many problems we have here in the state of Tennessee. And I know most Republicans really don't care, because they continue to attack our president. But in most cases, the first family, specifically the children of the presidents, are off base. I mean, out of order. It's just inappropriate. And you just don't do it. I know when President Bush was in the White House, and that was the last President Bush, Jenna Hager Bush would make inappropriate faces all the time, but it was off limits for the media to attack the first family, specifically the children. And then when Chelsea Clinton was in the White House, President Clinton and Mrs. Clinton at the time made it their business to ask respectfully that the national media not attack Chelsea, and then they didn't. So I know that President Obama and Mrs. Obama did the same thing. They asked the media and other people to respect their children's privacy and not attack the children. Well, Ms. Lauten, I guess you now realize that you should have followed that course as most other media outlets and most other communication professionals do, and not attack the first children, the first family, but specifically the first children. If you want to attack the president, he's the one who's elected, then go for it. Most members of your party do it anyway. But the first children, Sasha and Malika, hands off. So other Republicans out there, specifically those that want to have a field in communications, you better learn, and learn quickly. Stay away from verbally attacking Sasha and Malika. So let's talk a little bit about Ferguson, Missouri again. Most of you know by now that Darren Wilson has resigned his position as a police officer with the Ferguson Police Department. And I think that he was waiting to try and see if he was going to get a severance package. A severance package. Let me say that one more time. A severance package. And I think most of you know what a severance package is. Normally, when you resign a position, and I don't think it's normally when you resign, but I think normally when you are asked to leave, people, your employer may want to negotiate with you a severance package. Well, the Ferguson police did not give Mr. Wilson a severance package, and I'm wondering why. the guy is already sitting on over $1 million. Now, let me just be very clear. That is former Ferguson police officer Darren Wilson, who shot and killed Michael Brown, the 18-year-old teenager in Ferguson. He's now sitting over a little over $1 million. Now, how did he get that money? Well, in reading this article from AtlantaBlackStar.com, it clearly states that 28-year-old Wilson was paid at least $500,000 by ABC News. You remember the interview with George Stephanopoulos? $500,000. And then through the GoFundMe and Facebook campaigns, it has been reported that former Officer Wilson has $600,000 in a bank account through the fundraising efforts of GoFundMe and Facebook. So let's do the math. That's what, 1.1? About $1.1 million for killing someone. $1.1 million for killing someone. Well, I'm sure that the Brown family is probably going to file a civil suit, and if I'm with that Brown family, I'm going after that $1.1 million for the death of my son. Interesting times in Ferguson, Tennessee. I was watching Black Thought earlier today, and Dr. Hutchinson had mentioned that he noticed that the governor of Missouri had a news conference with our African American ministers standing behind him, asking for calm in Ferguson. And it looks like it's calming down a bit much, but I'd like to see our African American ministers engage in dialogue with law enforcement to talk about how important it is for them to pause and think about senseless killings of African Americans in general. That's the dialogue I'd like to see them have, not just in Ferguson, but across this country, because I think that's important. Let's talk, Eddie, we're going to talk a little bit about the felony convictions real quick. Whew, there was an article, viewers, in actually Tom Humphreys, who is an incredible writer here in the state of Tennessee, has a blog. It's called the Knox News blog. And my good friend Gail Jones Carson sent this out this morning as a part of her Gail's News, and it just kind of really caught my attention. And the article, well, the blog title is Felony Convictions said to block 18.9% of Tennessee blacks from voting. Let me read this with you, share this with you. And this is kind of an excerpt from an article that the Huffington Post posted on state laws that bar former felons from voting, and it was written by Ira Glasser. He's a retired ACLU executive director. So specifically here in Tennessee, and let me just read this, it's real short, but I really want to know what you think about it. I want you to go to the Dialogue with Deidre Facebook page and let me know what you think about this blog posting. Today, one of every 13 black Americans is barred from voting as a result of felony disenfranchisement laws. This has been especially, although not uniquely, true in the states of the old Confederacy, where felony disenfranchisement laws were born and nurtured after the Civil War as one way among ways to avoid the commands of the then new 15th Amendment that guarded and guaranteed the right to vote regardless of race or color. And it is the only one of those 19th century inventions that survived the civil rights movement and its transformative laws in the mid-1960s. Okay, this is important. To this day, the highest proportions of African American citizens so barred from voting are in southern states. 23.3% in Florida, 22.3% in Kentucky, 20.4% in Virginia, 19.9% in Tennessee, 15% in Alabama, and 14% in Mississippi. Now, when you consider that blacks who vote overwhelmingly for Democrats, and when you consider how close recent elections for the Senate and for governor have been in those states, it is no wonder that these states have remained solidly in the column that the media have dubbed red states. The final outrage about all of this is that such people, though barred from voting, are counted. Now, this is important, viewers. I want to start this over because I think you need to really listen to what I'm about to say. The final outrage about all of this is that such people, though barred from voting, are counted for the purpose of determining the state's electoral votes and numbers of representatives in Congress and state legislatures. They can't vote for Congress or for state legislators or in local elections because of their felonies, but they're counted when it comes to the state electoral colleges and the numbers of representatives in Congress and state legislators. Thus, like the infamous 3/5 compromise during the days of slavery, which counted slaves for the purpose of representation while denying them citizenship, voters not allowed to vote by felony disenfranchisement laws enhanced the political representation of the states banning them. How this can be tolerated by anyone claiming we are a representative democracy has always escaped me. That is pretty amazing. I don't know what you think about that, but I'd like to see our state legislators fight this, because once somebody has had an opportunity to serve their time, they've paid their dues. Yes, they've committed a crime. They should make it, and I mean the law should make it so much easier for them to get back on the voting rolls. And we should encourage people to do that. At this time, when we come back, you're watching Dialogue with Deidre. We're going to talk about the Affordable Care Act. We are going to talk about what an incredible piece of legislation. President Obama did something that former Senator Ted Kennedy tried to do, former President Bill Clinton tried to do, because his wife Hillary really led that health care reform effort when President Clinton was in office, and none of them were able to do it, but President Obama was able to pull it off. And we're going to talk about the benefit it's going to have and the benefit it is having right now for members of this country. You're watching Dialogue with Deidre. We'll be back in a moment.
This is Arm Candy, and on behalf of MUTV1, we would like to wish you a happy holiday and many more to come. Stay beautiful.
Mom, here's the mail.
Thanks, sweetie.
Mom, can I grab $20 from you today?
Yeah, sure, that's okay.
Cool, thanks.
So they say it's a man's world? I don't see anybody's name on it.
While they were doing their thing, we slowly changed ours.
Today, women can do anything men can do. And there's one thing we're even better at.
By the end of this message,
Another child will drop out of high school.
drop out,
Gone.
lost.
Our system is failing our children.
Our kids
Too many kids
aren't getting the quality education
they deserve.
too many kids
Are losing their future.
way too many kids.
We have got to make a change now.
Now,
Now, right now,
we have to change. Let's build a system where every child,
gets a great education. Every child. Every child.
no matter their zip code,
No matter their income.
No matter their race.
no matter what,
Every child. Let's give parents the power.
to choose the very best school for their child.
The power.
Power for every child. Join us. It's time to help every family.
It's time to help every child.
Every child. It's time.
It's time.
It's time for educational choice.
Wow, Teller Brown is your drugstore, and your drugstore. Hey, we everyone's drugstore. And we're located at 3333 East Chevy Drive, 794-3690. All medical plans. We support supported living, assisted living. We do it all. And guess what? We even have a $4 plan. Hey, call and ask Dr. Brown about that. I gotta go because she's coming with those boots.
The Carter Malone Group is a full-service public relations agency. Celebrating 10 years of being in business, the Carter Malone Group is located in Midtown Memphis and represents clients across the country. No matter what size your business, if you are interested in promoting your product or service and increasing your market share, contact the firm that can help you meet your goals. The Carter Malone Group. Call 901-278-0881 today.
And now, let's take some questions from the public.
Mr. Chairman, why do we keep cutting back on education?
Governor, you want to take that question?
Mr. Chairman, let's give this one to the Senate Majority Leader.
Since this matter was taken up in AB 3712, I think it best if I defer to the Assembly Majority Leader.
Actually, pursuant to Department of Education statutes, the State Secretary of Education would be more qualified to answer. Mr. Secretary.
My legal team has advised me not to comment at this time, so I'll humbly refer to our state superintendent of schools.
Pass. Definitely pass. Okay, county superintendent.
Well, young lady, it's just too complicated.
Can you tell me who's responsible for my education?
That is a good question. Governor?
Repeat the question, please.
I don't see why I can't get an answer from
You're
my...
asking a lot of difficult questions.
Oh, she sure is.
Who are you?
Well, I'm the governor.
What is this?
Your 2 minutes are up!
Stop the circus. Contact your legislators at thisbudgetblows.com.
The Harlem Globetrotters play basketball all over the world, every day of the year. To stay at the peak of our game, we have to eat right. When we eat better, we feel better. Kids are just the same. When they eat better, they feel better. They have more energy through the day. They may even get better grades. So talk with your kids about eating healthy, sustainable foods in school and serve those foods at home. Make a pledge to make a difference at earthday.org.
Back to Dialogue with Deidre. I'm your host, Deidre Malone. We are looking forward to you posting your comments or questions on the Dialogue with Deidre Facebook page. Please do. Let us know what you think about the show. Also, you can email me at deidre@deidremalone.com. We want to hear from you because what we'll do is we'll take your comments and we will read them live on our show. We just found out that Ms. Moore thought that we were taping on tomorrow, so she's not going to be here. But I do have a wealth of information about the Affordable Care Act, and I just want to share what we know and educate you some more on it. And, you know, people want to say that, you know, it's not effective, it's not working, but it is. And, you know, I was telling one of my team members, she wrote something and called it Obamacare, and a lot of people call it Obamacare, and I don't, because I know Republicans crafted that name, that title, and they meant it to be negative. And so I call it the Affordable Care Act because I think that's what it should be called. And based on the research that I've done, it is actually working. It was created because, you know, there's so many individuals in this country who that don't have health care, and because of that, they would go to the emergency rooms whenever they were sick, rather than try and work on preventative care and go to a primary care physician or go to a clinic to make sure that they are healthy. To go and try and take care of themselves. They'd end up not feeling well, going into an emergency room, which, you know, the healthcare costs there are astronomical. And so, you know, Democrats over the years, I mentioned this, from President Clinton to Senator Ted Kennedy, over the years have tried to come up with a federal law for health care. And so President Obama, with the support of the Congress, was able to pull it off. And let me just share some information with you about affordability when it comes to the Affordable Care Act. Consumers need to know that 70% of Americans with the Marketplace insurance plan feel that they can now afford health care. They can afford to get sick. They can, you know, because they can now pay for a premium. It's based on your income. American consumers have saved already $9 billion. Let me say that one more time, $9 billion since 2011, because the law says that insurance companies have to spend at least 80 cents for every premium dollar they receive from folks in the state of their care. Not only on things like marketing or getting a bonus for their CEO, because the CEOs make a whole lot of money. Families who receive an average rebate of $80, money that hardworking families can put toward their electric bill or back into their grocery budget. 85% of consumers who signed up for insurance on the new health insurance marketplace received financial assistance that lowered the cost of their monthly premium. I think that's good to know. This is right here is just talking about why it is working. because you had all the naysayers saying that it's not going to work, it's going to be too expensive. And a lot of Republicans that are now the majority in the House and in the Senate ran on defeating, repealing the Affordable Care Act. And, the president and his team put out this paper letting you know that it is affordable and that it is working. So on the new health insurance marketplace, insurance companies are finally competing for consumers' business. It's not like you just have to take one insurance company's coverage. You have options, and we should have options. So the consumers are winning because of that marketplace. Nearly 7 in 10 consumers who selected plans with tax credits through the federal marketplace during open enrollment got covered for $100 a month less. And that's nearly 46% were able to get covered for $50 a month or less. And it is, according to a major annual survey released last week, actually about 3 weeks ago, employer premiums for family coverage grew just 3.0% in 2014, tied with, in 2010, for the lowest in record since 1999. And when it comes to senior citizens, our seniors are on fixed incomes. This is what President Obama's administration is saying about how the Affordable Care Act is working. More than 8.2 million seniors and people with disabilities with Medicare have saved more than $11.5 billion on prescription drugs since 2010. That's an average of $1,400 per beneficiary. Can you imagine that? $1,400 in savings. The Affordable Care Act is making prescriptions more affordable for seniors by phasing out the Medicare donut hole. Part B Medicaid premiums are projected to be more in 2015 as they were in 2013 and 14. And let's just talk about the whole small business aspect of this. As a small business owner, probably for the last we've been in business 11 years, and probably half of that we've offered some level of insurance. And let me just say, starting out was really difficult. But if you want to keep your employees happy, you want to make sure that, there are wellness programs associated with, them staying well, then I felt strongly that we needed to offer some type of health care. And we do offer it. And so the law is making coverage more affordable for small businesses with tax credits and protection from excessive price increases. And then entrepreneurs can start their own businesses without the fear of losing coverage. Taxpayers in the economy. The changes promoted by the Affordable Care Act are contributing to what appears to be a fundamental change in the trajectory of health care spending. Since President Obama signed the law, we've held down health care spending growth to the lowest rate in history, and this has improved the federal budget outlook. Well, that's good to know because taxpayers are concerned about that and specifically how it might affect the economy. We've also held down health care cost growth per capita to the lowest sustained rate in a half a century. Slowdown in Medicare spending, here's some thoughts. The slowdown in Medicare spending between 2009 and 2012 has resulted in spending that is $116 billion below what it would have been, and the 2000 and 2008 trends continued. Spending per Medicare beneficiary is growing slower than the overall economy, and we've been able to extend the life of the Medicare Trust Fund by 13 years because of those changes. Now let's just talk about access for a minute. And then I want to give you some locations here in Memphis and Shelby County where you can go and work with certified counselors, application counselors, on putting together an application for health care benefits. Millions of people signed up for the marketplace plans, paid their premiums, and assessed quality, affordable coverage. Additionally, 8 million individuals enrolled in Medicaid and CHIP since the beginning of open enrollment, and that's an increase of nearly 14% compared to average monthly signups before October 1st. Now, hundreds of thousands in Pennsylvania may be eligible to get coverage due to the recent Medicaid expansion. We're going to talk about Tennessee in a minute because Tennessee is still not on board with Medicaid expansion. And I'm just trying to figure out, with all of the healthcare disparities that we have in our southern states, specifically in Tennessee, we're almost specifically in West Tennessee at the top of every healthcare disparity list, why we won't commit to the healthcare expansion. I'm just floored. You know, Republicans want to say they care about people. They're really not showing it. What they really care about, in my opinion, is not supporting President Obama's Affordable Care Act, because it would seem like they're supporting the president. Well, no, you're supporting your constituents, a lot of them rural, here in Tennessee, that a lot of these hospitals are closing in rural Tennessee, and they have to travel far places to get health care or to even visit a doctor. And a lot of them don't have insurance. So this will help them. Okay. Millions of young adults have gotten covered on their parents' plan, because the law says that they can now do so until they turn 26. My youngest son, he'll be 25 on Friday. He's still on our insurance. Now, you know, he has a job and he says he's probably going to roll off, and doesn't make any sense to me if it's already covered for another year. But you want to do that, son, I'm very proud of you. Spend that money, right? Just recently, the New England Journal of Medicine found that 10.3 million uninsured Americans have gotten covered since the start of open enrollment. In just 1 year, we've reduced the number of uninsured adults by 26% in 1 year. Americans finally have real choices, okay? During open enrollment in 2014, consumers could choose from an average of 47 plans. Contrast that to before the Affordable Care Act, when many consumers had few, if any, real choices. So today, we're able to announce that in 2015, there will be a 25% increase in the total number of selling health insurance plans in the marketplace. 76 million Americans with private health insurance can finally get preventative services such as vaccines, cancer screenings, and yearly wellness visits without share costing, because the law says that your insurance company must provide you with these services with no copay or out-of-pocket expense. This includes nearly 30 million women and over 18 million children. I mentioned earlier about how the Affordable Care Act, I mentioned earlier about how, Tennessee, a lot of this state is rural. And what this means for rural America is that, more than 7.8 million uninsured rural Americans under the age of 65 have an opportunity to enroll in this affordable health care through the marketplace. And so these are the numbers I want you to think about. Nearly 1 in 5 uninsured Americans live in a rural place. A greater portion of rural residents lack health insurance in comparison to urban residents. Due to lower income levels, a large segment of the rural population will be eligible for subsidized insurance, which means the government will help pay for your insurance coverage through the health insurance marketplaces. The health insurance marketplaces are expected to increase competition, and they've already done that. And in states that are expanding Medicaid, rural residents are more likely to be eligible for affordable coverage under the coverage expansion. So, that's good to know. Now, how does the Affordable Care Act help women. All right, we have about 6 more minutes, and I think this is important. I just want to share this information with you. Women are more likely to live in poverty at all ages, but differences are especially pronounced in middle and older ages. Women have unique and sometimes very costly health and medical needs. Some diseases and health conditions, such as cardiovascular disease and cancer, affect women at roughly the same rates as men, but women also have special needs related to health conditions that affect their reproductive organs, and such as breast, uterine, and cervical cancer. Prenatal care and delivery, while essential to the health of both the mother and child, are nonetheless expensive, coming at an average cost of $20,000 in 2011 for just an uncomplicated birth. You don't have any problems. To have a baby, it could cost you $20,000 if you don't have insurance. So, among adults ages 18 to 24, the poverty rate for women was about 15.3%, especially pronounced in those middle and older ages. Well, no, especially 18% for men. Among adults 65 and older, women are almost twice as likely to live in poverty, 1.6% of women and then 6.8% of men. Now, before the Affordable Care Act, women faced unique challenges in the health insurance market. In 2012, a 25-year-old, Brian, are you listening? Because he'll be 25 on Friday. A 25-year-old woman, even though he's a man, would be expected to pay 81% more for health insurance than a man, even for a policy that did not include maternal coverage. 85% more. Prior to the Affordable Care Act, 92% of health insurance plans in the individual market were gender rated, for example, charging 40-year-old women more than 40-year-old men for coverage. And in 2011, 62% of individual market enrollees did not have maternity coverage. Women are more likely to be covered as dependents, which make them more vulnerable to losing their insurance coverage prior to the Affordable Care Act. For example, if I'm on my husband's insurance and we decide we don't want to be married again, then I could lose my insurance. And if I'm a if I'm a homemaker and I'm going through a divorce, then 5 years ago that might be problematic. Today, it's not as problematic with the Affordable Care Act. I think that's important to know. Now, our last few minutes, I want to share a few things with you. We all know, because I've mentioned it several times on my show, that Tennessee has not signed up for Medicare, for the Affordable Care Act, for Medicaid expansion, right? We all know that. Governor Haslam has been dancing around this issue, going up to D.C. to talk to the Secretary of Health and Human Services about this. Tennessee wants to be special, create their own plan, while Tennesseans are suffering. Those that need it are suffering if they are not signing up now through the Affordable Care Act during this open enrollment period, which they should be doing. Tennesseans are suffering. But what we did find out is, and this was in the Tennessean earlier this year, February of this year, that healthcare.gov enrollments in Tennessee is higher than the national average. So more Tennesseans early on went to that website and filled out an application because they need health care. And our government doesn't think that we need it. Our state government, that is. So I'm going to leave you with this last thought. There are a number of organizations here in Shelby County that you can contact, and I think open enrollment is going on until December the 15th, if I'm not mistaken. And if I am, I'll put it on our Dialogue with Deidre Facebook page. I'll clarify that, and we'll put that on our Facebook page just so everybody knows. But I think it's December 15th. But right now you have certified application counselors that will work with you. I know Planned Parenthood has a number of counselors over there at their Mid-South location. That's one of the things that Miss Vicki Moore is, a certified application counselor who was supposed to be our guest today. And so if you call over to Planned Parenthood and ask for an appointment, and I think you do need an appointment, Ms. Moore and her colleagues can work with you, let you know what are your options for the marketplace, and work with you on filling out that application. My son just shared with me that there are a couple of other organizations, and you verified this, right, Brian, that are also working with our community, our citizens, to fill out these applications, and they are the Memphis Health Center. They'll work with you over there. Christ Community Health Services, they'll work with you. And I believe it's Shelby County government. It's probably the health department that will work with you, as well as Planned Parenthood. Give those organizations a call and let them know that you need to be a part of this, filling out your application to try and get affordable health care coverage. The marketplace is open, and if you need it, you need to apply for it. They have subsidies. If you don't think you're going to be able to pay your premium based on your income, if you have a low income, then they will offer you subsidies to help you pay your premium. Don't sit out there thinking that you're young and you're healthy, because even though you're young and healthy, you can wake up tomorrow with a health care problem and be in millions of dollars of debt. And it doesn't make sense when you do not have to. For the women out there, men out there who need health care, not feeling good, you need to go and apply. Do this for yourself, do this for your families, because what you don't want is to go to one of these hospitals, you don't have insurance, and you will have collection companies coming after you for hundreds of thousands of dollars, and you don't have to go through that. You just don't have to. Well, I want to thank our viewers for watching Dialogue with Deidre. It's been a great, great show. I hope you've enjoyed it. I want to let you know how much I appreciate you. I hope you had a fabulous, fabulous Thanksgiving. I know we did. I ate too much. Now, on Wednesday, our guest on Dialogue with Deidre will be representative from Latino Memphis. We're going to continue our dialogue about immigration reform and the executive order that President Obama put out there for the country to let them know that he is really concerned about immigration reform efforts here in this country. We're going to see what Latino Memphis thinks about that, what the president proposed, as well as we're going to have a conversation with Kevin Wood, who is the new executive director for WIN in West Tennessee, and we want to talk to him about his new job as well as his time on the Shelby County School Board. I know he was in a heated election with former school board commissioner Kenneth Whalum, but it looks like he won out when it came to the what the court decided. So we're going to talk to him about that on Wednesday. Thanks so much for joining us. Remember to let us know what you think on our Dialogue with Deidre Facebook page. And again, thank you for being with us today. Have a good day.